Hi, I'm Dr. Kirmani. Welcome to my channel, Patient Knowledge. For my new viewers and subscribers, I would like to mention that this channel is aimed at providing health education to the community with an intention of identifying risk factors and preventing them and making lifestyle modifications to prevent or delay the onset of the disease. Every weekend, I upload some health related videos where I describe in detail about a particular health condition. And today I will be talking about COVID-19 vaccines. Now, the world is fighting with this pandemic for the past 15 months, and vaccination is an answer to this. Well, the idea is to take a jab to protect ourselves and also protect people around us. This is useful in achieving 70% of herd immunity to fight this pandemic. Many people are skeptical whether to take this vaccine because they're concerned about the safety of this vaccine. This is because of some of the serious side effects reported in certain group of individuals, and many people also have some myths about this vaccine. I have collected some information from different sources and compiled that into this video to educate myself and you so that you can take an informed decision about taking this vaccine. Let's get straight into it and find out more about this. In this video, I will be giving you an overview on COVID-19, tell you about vaccines available in the world, side effects of these vaccines, who shouldn't take it, break some myths about COVID-19 vaccines. We'll talk about the post-COVID syndrome reported in some people who have recovered from the illness. There's also an autopsy analysis of COVID patients available. And at the end, I will be mentioning about a fungal infection reported in India in post-COVID patients. So stay till the end. What's COVID-19? Now, the term is to describe coronavirus disease that started in the year 2019. This was caused by SARS-CoV-2, and the first case was originated in Wuhan, China. As on 15th of January 2021, about 219 countries have been affected so far, 93 million cases reported, and it has caused 1.99 million deaths worldwide. Currently, second wave is started in the UK and United States. Now, who are the vulnerable group in the community? Those who are immunocompromised, whose immunity has been altered due to some pre-existing health conditions or because they're receiving some medication. These are people with diabetes, those who are taking medication for cancer and autoimmune disease, people who have increased belly fat, and those with blood group type A. Now, the types of vaccines available globally. Before we go into detail about these vaccines, I would like to mention something in general about vaccines and what it does to our body. Now, vaccines are designed just to prevent rather than cure an illness. Typically, they contain a tiny amount of a disease that's been either killed or weakened to the point where it cannot make you sick. Now, the idea here is to stimulate your immune system into action so that it produces antibodies in the same way as it should when you acquire an infection. We already have vaccines for 20 life-threatening diseases, and the WHO estimates they prevent up to 3 million deaths per year due to diseases such as flu, tetanus, measles, and many more. Most of the vaccines are delivered by a shot or an injection in the arm. Now, these are the vaccines available: Pfizer, BioNTech, Moderna, Novavax, Chinese AOS, Oxford, AstraZeneca, Covishield, and Covaxin. Pfizer and Moderna are being currently used in the United States and UK, and Covishield and Covaxin is popular in India. All these vaccines are to be taken in 2 doses with an interval of 4 weeks. They will provide protection after 2 weeks so that you will become immune to the disease after taking the jab 2 weeks later. The first dose gives about 50% of protection and the second gives 95%. Remember, when you take the vaccine, you still have to follow the other measures that you've been taking so far, such as washing your hands frequently, wearing a mask, and maintaining social distancing. Here are some side effects of COVID-19 vaccine that has been reported in certain individuals who have taken the vaccine. And these are very common and mild ones which are noticed in any other vaccines. They are fatigue or tiredness, pain at the injection site, that's the arm, headache, fever which may be mild, chills or rigors. Some people have reported body pain, nausea, vomiting, and even racing of heart. Now, how to manage these side effects? Hydrate yourself. Drink at least 3 to 4 liters of water in a day, and take paracetamol or Tylenol if you have body pain or fever. Avoid taking ibuprofen because of its serious side effect of bleeding from the gut. Remember, these symptoms start within 15 hours after vaccination and they settle in a few hours. If you're getting these symptoms, it's a good sign that your immunity is responding to the virus and you're being protected against this illness. Now, it doesn't mean people who have very mild symptoms or no symptoms are not being protected or the vaccine is ineffective. Well, it depends upon the response of your body and your immune system. A good tip would be to schedule the dosage when you have lighter schedule at work or take a day off from work. Now, who should not take the vaccine? People below 18 years of age, previous allergic reaction to first dose of COVID-19 vaccine, pregnant or breastfeeding mothers, because not sufficient data is available about the safety on these women, people with symptoms of COVID-19, COVID-19 patients who received plasma therapy in the last 4 to 6 weeks, anyone with any kind of illness that required hospital stay recently, people who have fever, those who have any allergies, people with abnormally low platelet count, people on regular medication for an illness, those who are on blood thinning medications such as aspirin, people on medicines that impact their immune system, and avoid taking second dose of the vaccine if allergic reaction has happened to the first one. Now, there are some myths about COVID-19 vaccine. And today I'm going to break all those myths. Many people believe that COVID-19 vaccine causes the disease COVID-19. Well, that's not true. It is meant to prevent you from the disease. It takes around 2 weeks for you to become immune or get the protection against the disease. Now, during that time, if you have already taken the jab and come in contact with someone within 1 or 2 days, you can become COVID positive. It doesn't mean that the vaccine has caused this. It's because you have come in contact during the period when you were not protected fully. Many people think that this vaccine alters the DNA. That's not true. Pfizer vaccine has mRNA and no virus at all. AstraZeneca has a dummy virus and Covaxin has small part of virus, so it does not alter your DNA at all. Some are of the opinion that it can cause autoimmune disease. Well, it is meant to trigger your immunity to provide you protection against the disease. It does not cause any autoimmune disease. Few people are of the opinion that this vaccine has been rushed through since it's available so quickly. Well, this is because it's a pandemic. We have more people available to run the trials, and that's the reason this vaccine is available early. Some people are not sure whether diabetes and autoimmune disease patients should take this vaccine. Well, these are the group of high-risk people and they should be taking it because they are more vulnerable to get the infection. Now, how long does the immunity last? Well, it lasts for about 6 months to 1 year, which means that you may have to take a jab yearly just like the flu vaccine. This is because of the emerging strains of the virus. Many people who have recovered from COVID have reported to have post-acute COVID syndrome. Around 10 to 80% of people have developed certain problems after recovering from this illness. These patients are called long haulers. They've experienced post-viral fatigue, headache, tremors of the hand, loss of balance, and some have problems with concentrating or confusion. The three main organs involved are brain, heart, and lungs. When the brain is involved, it causes brain fog or strokes in 90% of people. They have difficulty in concentrating and understanding and have a lot of confusion. They have cognitive dysfunction and loss of smell because the virus invades the nose and affect the organ responsible for smell. This is because of the blood vessels becoming leaky. When the heart is involved, it causes inflammation of the heart muscle cells, and this is called myocarditis. This can weaken the heart and leads to fluid buildup, which makes it harder to breathe and leads to permanent scarring. The virus affects the blood vessels of the lungs, and the lungs become scarred even worse than the smoker's lung. Now, many doctors believe that lifestyle modification after recovery from COVID, such as healthy diet and adequate sleep, can affect the outcome and minimize these effects. Currently, there are many clinics set up in the United States to look after post-COVID syndrome patients. The autopsy has been conducted in about 12 patients who died due to COVID. Autopsy is the best way to find out more about the impact of this virus. An interesting analysis has been found after the autopsy report. All the 12 patients had SARS-CoV-2 RNA in their lungs, which confirms that they were infected by this virus. All the 12 patients had pre-existing health conditions such as obesity, coronary artery disease, type 2 diabetes, high blood pressure, peripheral artery disease, and conditions affecting the lungs such as asthma and chronic obstructive pulmonary disease. Now, they found that 9 out of 12 people had this virus in their throat, 6 had it in their bloodstream, and 5 patients had it in the other tissues such as heart, liver, brain, and kidneys. Most of them had raised inflammatory markers, and this virus causes blood clots. This was their analysis. A fungal infection has been reported in some parts of India. This is called mucormycosis, which has been reported in a few post-COVID patients initially in Gujarat and recently also found in Delhi. This virus or this fungus affects the nose, sinuses, eye sockets, and also invades the brain, and it's fatal. This infection can cause death in people who are affected within 3 to 4 days. Well, this is because their immunity is lowered due to taking steroids during the illness, and if they come in contact with this fungus, it quickly affects their body. Many doctors believe that this can be avoided by altering the dose of steroids while they are giving it to the patients who are recovering from COVID, because the dose has to be altered depending upon their age and their immunity. That's all for today. Thank you for listening. I hope this information regarding COVID-19 vaccine has given you some idea about what this vaccine does to you and why it's important to take the jab. I hope this will help you to make an informed decision about getting vaccinated. And if you wish to hear something about, leave it in the comment box below. Bye for now.